Good evening and a very warm welcome to this evening's webinar, Supporting SAS Surgeons, an Era for Change. I'm Tim Mitchell, Vice President at the College and an ENT surgeon in Southampton. And I'm delighted to be joined by Vinita Shekhar and Ananda Nanu, who are the co-chairs of our SAS Forum. We're going to start off this evening with a short presentation, and then there'll be plenty of time for questions. So please do put your questions in the question box and we'll pick those up and deal with as many of those as we possibly can. Any of those that we can't deal with this evening, then we will get back to you in due course, and you'll be able to see this webinar or your colleagues who couldn't join you this evening through the college website. So it's been a very exciting year for the college. We have just taken possession of our newly refurbished headquarters in Lincoln's Inn Fields, a project that has taken 3.5 years, and of course somewhat longer than anticipated because of the COVID pandemic, which no one could have anticipated when the project was first started. Here you see some artist impressions, but I had the pleasure of going down to the college a couple of weeks ago when I was in London involved with MRCS exams. The front facade of the college looks very familiar, of course, but if you go back to round to the back of the college onto Portugal Street, you'll see, as you can see here on the artist's impression on the right-hand side, a fantastic new entrance, which is really striking. And this will be the entrance through which visitors are encouraged to come to the newly refurbished Hunterian Museum on the left side of the ground floor once that opens. But the college, of course, is much more than a building. We have over 28,000 members, and we are very keen to engage with those as fully as we can. The other important event of the year, of course, has been the publication of the Diversity and Inclusion Report led by Baroness Helena Kennedy QC. And one of the strands of that was the importance of engaging with our SAS surgeon members. And as part of that, a recommendation to develop an SAS action plan, of which we'll hear more, which is being led by Vinita and Ananda. And I'm sure they'll want to tell you more about that this evening. So I'm delighted to hear that we've got more than 300 attendees this evening, which is a fantastic number. Very much looking forward to hearing your questions. And for the moment, I will hand over to Vinita. Thank you.
Thank you, Tim, for the introductions, and thank you to all the listeners for sparing the time this evening out of your family time. So I'm just going to highlight the contracts update, not because I want to talk about contracts, because of its roles, which we are going to use in our new SAS strategy. As Tim mentioned, first trigger for what we are talking about today was our diversity review, but it was just a coincidence that new contracts have been introduced in England, Northern Ireland, and Wales. And what if one looks at these contracts carefully, you will realize is a huge difference from 2008 contract. So the main difference being is the education aspect of the contract, where they have introduced generic capabilities framework. Now, this generic capabilities framework is the evidence of core capabilities and skills which are expected for safe patient care at the senior level. Now, I have given 2 links here, which we will share with you on these slides. I would strongly urge for you to go to these links and read about the contracts and the finer details of generic capabilities framework and other aspects of the contract. This conversation, this webinar can certainly not cover all these aspects, and there's a very good information out there and very good understanding on the background of what they really mean. So the template person specification is which gives clear description of the requirement of an individual role, and the notes on the person specification template is the description of the requirement for an individual role as per a particular specialty. The concordant is the one that is important to the college, And this is an agreement between the college, BMA, and NHS employers for the appointment process. And that's where the college relevance comes to these contracts, and that's where the education aspects comes in. And there is much information on specialist grade appointment guidance, which college is looking at. And I think there's a lots of work going on behind the scenes, which we will be sharing in the due course as and how it develops. So going forward, so there are three things we need to consider as we enter a specialty grade SAS contract 2021. It's a reformed contract with expectations of better support for career development from the college and from the employers. Now, what we need to look at 12 years in advance is the entry criteria for the specialist SAS contract 2021, because a specialty doctor who enters the SAS job has 12 years to develop themselves to reach that competency. And I think that's where the college comes in to support the education for the SAS development. There are certain specialty specific person specifications, and we are working with individual specialty associations, and we will be speaking to the SAS reps on the specialty associations to see how we can help individual specialty in its own merits. And the appointment process is somewhere college is already looking at, and we will be sharing the news as and how it develops. So what expires the long-term change? Now, this is a very complex issue because there are different aspirations, and I would put on the top is an individual's aspiration. As one says, no one can help you unless you want to be helped. So that means that you need to take responsibility for your career from day one, and you need to utilize your time from day one of your SAS job. What that means for you is engage with your local governance processes and make use of educational resources which are local to you or which are regional or national. The NHS Trust aspirations should be working with you, providing those local governance processes, educational resources, and opportunities for management and leadership skills during your 12 years before senior SAS opportunity. The RCS aspiration, so college has been looking at the contracts very carefully, and following the diversity review, we are looking at our strategy as how we support ourselves in regards with education or any other opportunity for that matters. And then we are looking at joint surgical colleges aspiration, and for that we are in the process of developing an intercollegiate committee for SAS education. So you can see there's a lots of work going on in the background, and what we want from you is your voice. That means we would like your thoughts, we would like your contribution, and we would like your support. So please email us, show your interest. If you want to be involved, do let us know. Ananda will give you a little information on our upcoming opportunities to join the forum, and I would be very hopeful to see many of you joining us to contribute to our work. I will once again say that you do not have to be SAS Forum member to contribute to our work. Even staying outside the forum, staying outside the college, you can still contribute hugely, and we do need people across the country where we can approach, where you can approach us, and we work as a collaborative team. So I will hand you now to Ananda, who will give you a little bit more information on what we do behind the scenes and what are our future aspirations.
Thank you very much, Vanita. So I'm Ananda Nanu. I'm a trauma and orthopedic surgeon. I just thought that I'd let you know that I co-chair the SAS Forum of the Royal College of Surgeons of England. The chair is Vanita, who has been extremely dynamic, and the SAS Forum itself has done a huge amount of work. And while I'm speaking about it, most of the work has been done by SAS Forum members, and there's an opportunity for two people from this audience to apply by, and we'll send you the link. Please apply, join us, join the forum, and make changes occur. So what have Vanita and her colleagues on the SAS Forum achieved in the last 18 months? Well, the first thing is they have obtained access for the SAS people to the ISCP, which is the Intercollegiate Surgical Curriculum Program. Now you say, well, what's so great about that? Well, the point is, you know what you can do and you know what you're capable of, but there needs to be evidence that is objective and which is accessible by anybody to demonstrate what you have done and to what level you have done it. And now there is access for SAS people to this. The SAS Forum, not just Vanitha, but other members of the forum, have fully participated and taken part throughout in Baroness Helena Kennedy's Equality and Diversity Review, which has been a very hard-hitting report that speaks the truth to power. And it has been commissioned by Professor Mortensen, our president, and there is every determination that every single one of those recommendations will be adopted, and it is up to all members of the college and those who are SAS surgeons, whether you're members of the college or not, to inform us about how you would like us to do that. So the GPC framework at the Association of Medical Royal Colleges, Vanitha and the SAS Forum contributed to the task and finish group. So what you are seeing in terms of the SAS contract new specialist grade has been contributed to by the SAS Forum and by Vanitha. And there has been information about this which you may not have seen. The SAS Forum has participated in the Future Surgery Conference held by the RCS, by the Association of Surgeons in Training. And now most college committees have a dedicated SAS representation. So all points of view, not just those of consultants or trainees in the specialist trainee grade, are listened to, and any change is seen in terms of how it affects all members of the team, not just the consultants or the specialist trainees as is perceived. And part of that is the representation which has to be made by active people on this group. You can see all this on the college website, and I move on to the next slide. So what are we trying to do? What we are trying to do is to improve access to all professional roles for all SAS surgeons. You're part of a team, and whether you leave the team or you are working as part of a team with other members who are at par with you or who are younger than you in terms of more junior or consultant-led. It depends on the role and it depends on the institution in which you're working. But we are looking at professional roles and professional capabilities to do that role, and it should not just be restricted to a person's grade, but on the competencies that you achieve. The SAS Forum has been in collaboration with both the JCST, the Intercollegiate Exam Board, and CSER for better resources and support. And I know for a fact that Vanitha has been fighting tooth and nail to get access to these, and she's achieved it through the SAS Forum, through a very active SAS Forum. And I think I could say that sitting on the sidelines as co-chair, I can see how hard this particular SAS Forum has worked. And I think it would be fair to say that this is the hardest that they've worked in the history of the college. So the SAS strategy is going to follow closely on the Kennedy report. And for the first time, we're having an open meeting with the specialty associations, SAS representatives. So we are not limited purely to looking at one facet of surgery, but looking across all 10 surgical specialties and look at what they have in common and what each individual service requires. So that can be, can I pass this back onto you now, Vanitha?
Thank you, Ananda, for your complimentary talk. So in regards to developing SAS strategy, I think we are still in its foundation stage. So if you have read Kennedy report, you can see that recommendation 7 on the page 37 is the one that's relevant to us. If you haven't, I would urge that you should read the report. I think we learn a lot from everyone's experience, and I'm sure that many of us will work differently after reading the report. I certainly have learned a lot by contributing to the report and by reading the report. So what are we looking at? So we have a wish list from the Kennedy report in regards with SAS strategy. So my highlights or my wish list is number one, which is at the top, is education and training. And then comes examinations, because obviously examinations are very important to all of us, because that are the hardcore evidence of our knowledge and competencies. But also important is leadership and management, because that fulfills your generic capabilities for the future roles. And at the same time, we are also working with Faculty of Dental Surgery. We are certainly not leaving dental specialties behind, and it is going to be mirror image of what we do in the surgical side will be what we will be doing in the dental side. So the support is there for all members and fellows, whether they are part of a surgical medical team or they are part of a surgical dental team. I will hand over to Tim to talk a little bit more in depth about behind the scenes in the college, how the officers are looking at the whole workforce support for this work. You're on mute, sorry.
Yes, sorry, thank you. So if we can move on to the next slide, please. I think, Vanita, you touched on this earlier, the Intercollegiate Committee for SAS Education, touching on the top of your wish list. I think it reflects the recognition across all 4 surgical royal colleges of the fact that whilst you've heard the good work that we and other colleges have been doing to engage with SAS surgeons, we recognise that there's much more to be done, and that SAS surgeons have to some degree been dissatisfied with what's been on offer to date. I think it's probably fair to say. So this is an exciting new initiative which is being led by Professor Mike Griffin, President of the Royal College of Surgeons of Edinburgh, on an intercollegiate basis, including all 4 Royal Surgical Colleges, in order to support education, career advice and development for SAS surgeons. And it's a committee that will include representatives from the education leads from each of the 4 surgical royal colleges, representatives from JCST, Joint Committee on Surgical Training, Joint Committee on Examinations, and representatives of the 10 surgical specialty associations to work together to improve the offering for SAS surgeons in terms of education, but also to improve their opportunities for moving forward to sit the fellowship exam and develop their careers. So this is a very exciting initiative. It's really just started. It received approval from the Joint Surgical Colleges meeting of the 4 surgical colleges only last month, and there'll be more to follow on that. But I think a very exciting initiative, and very much, I hope, trying to address the wish list that Vanita has expressed. Next slide, please. In terms of the college's role in terms of the new senior SAS or specialist grade, as Vanita has said, there's much more information available through the NHS Employers website, and this is again at its very earliest stages, and I'm sure that a number of you will have questions about it. There will be 200 posts in the first instance across all specialties. We anticipate that there may be around 50 in surgical specialties. As far as we are aware, none has been created as yet. Vanita, I think, mentioned the concordat that has been reached between the Academy of Medical Royal Colleges, the BMA and NHS employers around the process. And there will be a process that is comparable to that that's in place for consultant appointment. The college will be invited to provide an assessor who explicitly will not be included in the shortlisting process, but will attend the interview for these posts and make a contribution to that. There is also the opportunity at the employer's discretion for them to approach the college for support around developing the personal specification for the role. So again, this is in its very earliest stages, and it remains to be seen how this develops, but another exciting development. So thank you. Next slide, please. So I think both Vanita and Ananda have touched on this. We are very keen to involve as many people as possible in the implementation of the Kennedy report. One of the key words that features in the report is belonging. It's about ensuring that the college engages with its members and that its members feel fully engaged with the college. And if you have any comments, questions, or wish to get involved, then please do contact us through the diversity@rcseng.ac.uk email address, as you see there on the screen. And we'd be delighted to hear from you. Thank you. Next slide, please. So that completes the short presentation. If you have any further questions, we've had quite a number already, which Jane is going to put to us shortly. But if you have any further questions, please do put them in the question box and we'll do our level best to answer as many as we possibly can. So Jane, over to you. If we've got some questions to ask us, please.
We are starting to come through, and I will try and sort of club them accordingly. Mindful that we are trying to focus on the sort of college's approach, but we have had one quick question that I feel like might have a quick answer, so apologies if it doesn't, and feel free to bump it. We have had somebody who has asked a quick contract question, and they're asking that will the contract for specialty doctors who have already been working in the NHS for more than 10 years be automatically moved to a specialist grade doctor? My local trusts have advised me that they haven't had any guidelines. Is that something? You're muted, Vanita.
Sorry. So contract is open to, it's a national contract. What we need to remember is it's a national contract. I think you have 6 months. So if you are on a national contract, you should have been contacted by your employer to ask if you wish to move. So it is your wish whether you wish to move to the new contract or not. And I think there's a 6 months window to move to the new contract. Now, this contract is unfortunately not open to locally employed doctors, or you could say trust appointed doctors, and it will be the trust discretion to whether or not they offer you to enter this new contract. So it doesn't matter whether you have been in the old contract for 1 year or 12 years or 20 years. If you wish to move to the new contract, you are allowed to move to the new contract. But there is much guidance out there on BMA and NHS Employers website, and there are lots of frequently asked questions, and I'm quite confident that I have seen the answer to this in many different ways. So please do visit those websites. We have provided the link in this talk. And if you have any further questions, please do email us and we will do our best to respond. I hope that answers the question.
Thank you, Vanita. I'm going to move us on to some of the questions we've had regarding the sort of college's role and our plans for supporting SAS surgeons going forward. One which is potentially quite a controversial question, but I think we can cope with. One of our advanced questions was, what has changed and why is the RCS suddenly interested in SAS doctors?
Do you want me to take that? Yeah, you take it.
Nand, you go first, and I'll chip in afterwards, perhaps.
Okay. So I've been on College Council since 2013, and I think this process has to be driven because you need somebody or a forum that can speak for itself. And I think at the moment we have a very active SAS forum, and they have spoken very clearly about the shortcomings of the system in terms of acknowledging the work and addressing the opportunities that should be offered to SAS people. And you have a very voluble spokesperson who's on the panel here today, who's been fighting that corner and fighting it very successfully. The other reason why the college has taken an interest is we have very honestly, through our president, asked for a report to tell me what's wrong with what we do, how can we do it better? And having received that report, which is the Kennedy report, we have agreed as a council to act on every single one of those recommendations. Now, that is not an easy task, but we are determined to take it forward. And for that, we need the support of people who are affected by all the things that you've been mentioning so far, and come forward with positive suggestions about how we can change. So it's not new, but the change in direction in terms of placing an emphasis on treating people equally is something that has come out of our diversity review, but which has been driven by the SAS Forum so far, who've contributed to the report. Tim?
Well, thank you, and I agree entirely with what you've said. And again, we'd like to pay tribute to Vinita for the energy that she has shown in driving that forward. And of course, she was also an instrumental part of the panel that advised Baroness Kennedy in the production of the report. And as I've talked about in indicating the plans for an intercollegiate education committee, this is recognised not only in our own college but across the other surgical royal colleges, that it's very important that we improve the offering that's available for SAS surgeons who quite clearly need more support, and that's what we intend to give. Jane, do you have another question for us?
Sorry, I was doing some quick sifting on the side. So somebody in the sort of live questions has highlighted something which actually I recall from previous work with the SAS Forum, that they were highlighting that they used to work in a hospital where the deanery had specific funds for SAS doctors to support courses and improve their career prospects, and their sort of question, I guess, or they were trying to highlight was, is that deanery funding still available? And if not, can we ask for things like that to be happening as part of our sort of strategy? I realise we can't necessarily make it happen, but we could put some pressure on potentially.
We were discussing this earlier, Vinita and I. So Vinita, do you want to take that up?
Yes, so I can answer that question. Yes, there is a lot of funding available for SAS specifically, but how it is utilized and how it is offered is very different from one region to another. Now, I work in Scotland, and I can tell you we have a huge support from the SAS Education Advisor Group, which are known as SAS tutors in England and Wales. And they work very hard to make sure the funding is utilized to its best and in most productive way. However, the English model and the Welsh model is very different from Scotland, and that's something you should be asking your SAS tutor. So you all have SAS tutors in each individual trust, and they should be able to answer these questions in regards with how the funding can be utilized and how it can be accessed. And I know with the new contract, if there are SAS advocates, there might be new funding coming in through the NHS Trust. That will be additional funding. And in realistic terms, we do have lots of study funds. We get £1,000 per year or 3,000 for 3-year cycle. So you're allowed to use 3,000 as one bunch, or you can break it down into as many as small groups as possible. So there's lots of money out there, and so encourage you to utilize. I have utilized each and every penny for the last 13 years. I've been an SAS doctor, and I have lots of support from NES in Scotland, and I can tell you it's been very rewarding career in its own rights. But aspiration has to come from within yourselves, and yes, there is lots of funds out there and lots of support. Thank you.
Great. We've had, again, a bit more of a comment, but I'm sure that people have had thoughts about it, and it's a suggestion possibly for our strategy, is that one of the most important things for SAS doctors and surgeons is acknowledging their contribution, and most importantly, coding their activities under their own name to help them strengthen their appraisal process. Does anyone have any comments or thoughts? Again, I feel like this is definitely something we've talked about at committees and forums.
So shall I pick that up? So looking at trauma and orthopedics, one of the things that we've been pushing for, and which does exist but very people don't know about it, is that if you are working independently and you're doing hip and knee replacements, you should have an NGR number of your own. So you can, just like exactly the same as a consultant, they have the numbers, they can then see how many cases they have done and what their output is, what their results are, and where they fit into the two or three standard deviation bell curves that we, the funnel plots that we have. So that's something that, you need to be able to measure what you do as a senior person. And there is no reason why you can't get it. You have to apply to the NJR and ask them, and you can get a number. So there will be no difference between what you are entitled to and what any consultant is entitled to, and your numbers can be counted separately. And again, if you look at this new specialist grade that is due to have started on the 1st of April, but nothing has come on stream so far, the principle is that they will be working independently. So all these things are new concepts. And part of the problem is that while Vinita and Tim and I have some information on this, it has not percolated through to a lot of the trusts and the trust management. So though there is funding for these things, the information may not be out there in your individual trust that such a grade exists and it can be appointed. And that information hopefully will come through after the first tranche of 200 this year have been made. And that's all I had to say on this.
Perhaps I can just add to that, Ananda. The National Joint Registry sits independently, and presumably an SAS surgeon can register with that in their own right. If there's a difficulty within trusts and hospitals, then the appropriate mechanism will be to have a conversation with the coding department, probably through the clinical lead for your department, to see whether there's that can be done. I see absolutely no reason why SAS surgeons shouldn't have their cases registered under their own name. It's probably just a question of having the right conversation and having some advocates on your behalf to ensure that can happen.
Sorry, I'm just getting a lot of questions in very quickly. I'm trying to sort out.
While you're looking at the next one, the other thing is, as part of your appraisal, if you want to look at your output and what the results have been, how would you do it unless you have an independent code? So I think that's the particular driver you should use to get an independent code. Back to you, Jane.
Thank you. We're getting quite a lot of questions about the CSER application and lots of very complicated questions, which I feel like we would struggle with a little bit. I just wondered if, Vinita, I know we've been doing some work with the JCST. I wondered if you could just let people, because I feel like it might be something that's easier to answer after the event. So to delegates, I'm not ignoring your questions. We can answer some of these better, I think, in writing. But I didn't know if you had anything you wanted to say about the CSER application work we've been doing.
The only comment I will make is CSER is very specifically GMC and JCST process. We as a college have no contributions to it, but we are trying to be part of this group. So I think this is some work in progress where we might have some say in the process, but I know as a group on GMC, there are SAS representatives from academy and from individual deaneries who sit on the committee. So, there is some representation there, and I'm sure that they are all doing their best, but it's a very complex process, and I don't think our forum has much information on CSER. But if we have any questions, we are happy to find answers and come back to you, or we might direct you to the correct people who might be able to answer those questions. We are happy to do that, Jane. Thank you.
Thank you. Sorry, I'm just really mindful that a lot of people were asking, and I feel like that's probably in fact, it is going to be a webinar all by itself. We are planning to do another session later in the year, which will be discussing CSER and helping people with applications. So, like I say, I'm not ignoring you. I'm just trying to make sure we get through as many of these questions as we can. What support does the SAS Forum offer to female surgeons with children who have had to take career breaks and are struggling with career progression as compared to their male colleagues?
Tim, do you want to answer that question? Because I think it's relevant to one of our recommendations from Kennedy's report.
Yes, thank you.
Yeah.
Although, of course, we've highlighted the fact that the Kennedy report specifically invites us to develop an SAS action plan, and we've stressed how important that is, and that we fully support that. Of course, there's a whole number of other recommendations which are also very relevant to SAS surgeons. And we've been asked to develop a Parents in Surgery program as a flagship program, recognizing that, as the question implies, that there are specific issues for parents in surgery, particularly around people having children, having a family around the time that their career is developing at specific points of examinations or moving from one grade to another. So that is very much something that we will be doing. Fiona Mint, who is our Vice President-elect, is going to lead on that, and you'll hear more about that in due course. We recognise how important that is.
Can I also add, Tim, we do have Women in Surgery group, which is a very active group being led by Mrs. Farabati, who is absolutely fantastic in what she's doing. I would recommend you join the group. You could be a member of the WINS group, and I'm sure you'll have lots of support there and lots of advice and lots of information out there in that group. So we can put a link to the WINS website on our college website itself. And if Jane, we could even include even an email where members could actually drop their queries in regards with any questions they may have with this. Thank you.
Yeah, very happy, always keen to promote the Women in Surgery project, as Vanita and Tim and Nanda are probably very aware. We're getting lots and lots of questions through, which is why I'm being a bit hesitant at times, because I'm just trying to pick out things that are the broadest relevance to the group. We've had a suggestion, which is mirroring something that one of our association colleagues are doing, and hopefully will come up at our association's meeting. So apparently BAUS, so the British Association of Urological Surgeons, have just started a new SAS project and are doing an excellent job to promote the SAS urologist. And they have appointed mentors to help people, guide people through the CSER route, and the individual themselves has just been appointed to counsel. Is there any plan for the Royal College to do something similar?
Tim, do you want to answer, or you want me to say something on this?
Yes, as well as the SAS action plan that we're developing, again, we've been asked to develop a mentorship program to support members and fellows, again, at its earlier stages, but that will involve mentorship across the board for people at different stages of their careers, and would also include SAS surgeons. It's also very much on the agenda for the new intercollegiate SAS Education Committee that I mentioned earlier. So I think there'll be a number of agencies hopefully working together to provide that sort of support.
And just to add, we are very happy to share your thoughts. We are very happy to adapt your thoughts. So if you think you have any guidance, you think that's working well, please share with us, and we are happy to see how we can bring it to the college. Now, the mentorship program as part of Kennedy report recommendation is being led by one of our vice presidents, Tim Goodacre, and we have a place on the table where we will be looking at mentorship program for SAS, because I do personally believe it is different from a mentorship program for trainees and consultants. So please do share your thoughts, and I would really welcome if you're even happy to apply for a place on our forum. You can guide us how we should be doing it. So yeah, please share and email.
Super. Somebody has also just quickly highlighted that the WENTS group, which is the Women in ENT Surgeons group, also run a mentorship program which is open to SAS surgeons, which I realise is not necessarily relevant for all of our audience, but maybe of use to some of our audience. again, just trying to make sure that we talk about things that are as relevant as possible. We've had a few comments regarding challenges that people have been having about implementing guidance issued by the college. So some of the work I assume that we've done in the past, where we've made suggestions regarding language and sort of behaviours towards SAS doctors that are disregarded by trusts. And the asker is asking, is there sort of any plans to sort of enforce these, or how can they help implement guidance from the college for SAS doctors?
So sorry.
No, Tim.
Yeah, I personally believe that this is an educational issue. It is understanding and accepting the fact that members of the team should not be treated differently on the basis of anything. We are now accepting in terms of diversity and the other factors brought out in the report. But I feel that most importantly, and I understand exactly where the question is coming from, there is a certain perception of SAS surgeons that still exists today. And if the college's guidance is contrary to that, I think it is important to bring to either to your tutor or to your hospital management the fact that this discrepancy between nationally accepted guidance and recommendations is not being followed in that particular organization. Vanita?
Absolutely, Ananda, thank you. Very rightly said, but I also would say is that's one of my wish list. How do we create links between college to a trust, trust individual departments, or between trust and deaneries? So we will be working on this, and I think it's a question of awareness. But one thing I will say is I think it has been my nature in the past that we do it, but we don't show what we do. So my advice would be to, try to talk, have a conversation within your department, and, try to express your views, but at the same time, have an open mind if there is something we need to do from, looking at the vision from the other side. So it's kind of a teamwork we have to do, but it's more of having a clear and honest conversation within a team. But yes, we will be working on this, and hopefully we will bring more awareness between the other groups, which is trainees or the consultants or even the nursing staff, in regards with what we are and what we can do and how we can contribute to a wider surgical team.
And if I can perhaps just add to that, I mean, the difficult without being too specific in this case, but the college produces guidance, which is by definition therefore guidance, but we're very keen to work with trust and hospital boards to ensure that they see the importance of that and the relevance of it. And depending on the circumstance, it might well be relevant to involve our regional team and perhaps our regional director, who can have a conversation with trust representatives that might be helpful. But it depends on the exact nature of the problem.
I think part of the problem really is that you have to call it out. And very often people wish to be inoffensive, wish to be fairly quiet and not stick their head above the parapet. But if some behavior is actually offending you, or if it's not right, I think it's important to point that out politely, but to point it out. And then if that doesn't resolve the matter, then I think you do have to pursue it further, because it's in this day and age, it really isn't acceptable.
So we've had a comment which I think sort of relates to this, which is that that one of the main issues this individual feels is that SAS doctors by their nature are not necessarily, or the trusts rather, are not as accountable for SAS doctors as they would be, for instance, for trainees or similar. And I guess the question there really is, like, who do people turn to if they're having issues with their trust and feel like they're being treated unfairly by the trust, I guess, in the way that a trainee could raise it via the deanery or a sort of higher body?
So I would suggest is the closest point of contact for SAS in a trust is the SAS tutors they have their representatives on the LNC, and they have BMA representatives. But before you go outside the department, I think it is good to have a chat with your closer colleagues within the department. You can raise a concern with your clinical lead if you have concerns about how you're being treated. And I'm sure if clinical lead cannot help, whoever you feel close to within the department, speak to one of the senior colleagues. There is a lot of local guidance within each trust where there are point of contacts, and there is a lot of help out there. It can be challenging, it can be unpleasant, but there is a lot of help out there.
And in addition to that, the college has its confidential advice service, which you probably will have seen advertised. It's been advertised through email output and through the bulletin and website. And that is available for people to contact entirely confidentially. They may not be able to deal with the problem directly, but can at least signpost people in the right direction. So that's another option to consider.
Thank you. Again, I'm just trying to sort of pick out the broadest of the questions. As Vanita said, this is my normal point in the webinar, we won't be able to get to all the questions, and I realise that's very disappointing. We will try and address as many of the issues and questions as possible in follow-up. So if you have got a question, please do send it through still. We will try and get to you either via website or by some of our FAQs, which we're working on at the moment. So do keep sending them through, and sorry if we don't get to you. We have got a question which is a little bit CSER related, but I think probably one that's again quite straightforward, or might be one for us to consider. There's been a relaxation of periods for training due to COVID, and obviously SAS doctors have been playing a large and very important role in the fight against the pandemic. Do we know, or could we ask if there's are any plans for a relaxation of the 6-year period for CSER applications in light of the pandemic, in the same way that trainees are being given periods of grace?
I don't think I have much information on that, Jane, but I know that what CSER or GMC has advised is they are still accepting applications, and they are considering them on case-to-case basis. So I think GMC is best suited for this answer. And if they speak to the CSER advisors on GMC, who have a huge amount of knowledge, and I have attended the workshops personally, and I know that they know most of these answers. There might be some reservations knowing these COVID times, but I'm sure that they are still working on CSER applications, just like trainees applications.
Yeah, okay. Thank you.
And I think it's important to add to that everybody recognises the disruption that CSER's caused to all our professional lives, and particularly difficult for those people who are working to a progression in their career. And everybody has been doing all they possibly can to minimise the impact of that. Yes, look at the GMC or GMC website might have some information around that, but I would be surprised if there isn't an accommodation to recognise the difficulty that everybody has had.
Maybe we could post, Vanita, a direct link to the CSER representative so they can then answer this question rather than you having to go around looking for whom to send the email.
I'll do that. Thank you.
Perfect. Yeah, we will try and send some helpful links in the email after tonight's session as well. Like I say, we will try and address people's questions, even if it's not in person. Again, it's another intercollegiate issue, but again, probably one worth raising. One of our viewers, delegates, attendees, has been told that they cannot have the signature that they need to enter the FRCS exam, because the trust feels that it means that they are implying that they are at consultant level. Their concern is that this is being managed on a trust level, and they feel there should be a more general assessment for SAS doctors that is fairer, I guess, or a change to the application process, which I don't think we can necessarily directly influence, but we can definitely raise awareness in our meetings with the exam boards. I don't know if anyone's got any comments.
It is obviously a very individual thing. I have signed several forms allowing people to go through, and these were locally employed doctors, not SAS people on a national contract. So I think, you probably have met an unsympathetic individual. I'm sure there must be other people that you work with who would be able to sign the form allowing you to sit the exam. I think you need 2 signatures, certainly in trauma and orthopedics. And I don't think you need a specific person. It just needs to be one of the consultants that you work with. I'm not sure about the exact circumstances, obviously, but there isn't a general reluctance. If they feel that you're up to it and you can make a success of it, there's no reason why they wouldn't sign a form allowing you to do it if they're happy that you've achieved your competencies.
Super. So we've got a question about the plans that we've been talking about regarding the SAS strategy and the work that the college is doing, which I feel like we touched on in our pre-meeting actually. So are the future plans, including those relating to education and training that we've been discussing, only related to those on national specialty doctor contracts, or are some of these available for locally employed doctors as well?
I think I can answer this question, Jane. It will be available to all, no matter whether you're SAS or LED. Just to make you aware, our forum has 2 LED representatives. We do consider them part of our group. And if you think you want to get involved and guide us more what you would want us to do, please drop us an email. But yes, all resources, all information, all advice should be available to SAS and LEDs both. Thank you.
So, I mean, anybody who's part of a team that deals with patients needs the same opportunities for education and mentorship. Just because we haven't provided them hitherto doesn't mean that it is not their right and something that we should be providing. I think it's one of the aims of the SAS Forum that we will do so.
Super. Just again, sorry, there really are so many questions coming through. It's making it a little bit challenging. Right. Sorry.
Jane, while you're looking at the questions, I can see a couple in the chat box before we shared, and I think Tim might be best suited to answer this. How does the college see the future of the SAS in 10 years' time? I know it's a very challenging and very aspirational question, but maybe we can talk something about it.
Well, it's an interesting question. I'm going to turn the question around on you very shortly, but I think that the first thing is that we will see a situation in which SAS surgeons are much better supported by our college, probably all 4 surgical royal colleges, and feel a much more integrated part of the workforce. I think that's really what we're all talking about, what we're aiming for. Obviously, we have this new specialist grade developing. It's at its very earliest stage, and we'll see how that develops. I think that's a very interesting and exciting development. We'll see how that develops. I think it's dangerous to try and predict what the future will look like in 5 or 10 years' time. Certainly, the position we're in now, we wouldn't have predicted 5 or 10 years ago. But I think what I can say as a college, we are looking to engage with all our members and fellows to create that sense of belonging that is integral in the Kennedy report, and we very much see SAS Surgeons as being part of that. So I think the future will be brighter for everybody. But I'm now going to turn the question back to you and ask you what you think.
Thank you, Tim, and thank you for turning it back to me. I absolutely agree with you. I think sense of belonging is one thing we have realized that majority do not have. So that would be huge aspiration to achieve. And I'll tell you that it's very challenging. It's not easy because there are different expectations from different groups, and meeting everyone in the middle is a huge challenge. How I would like to see in 10 years is what we are trying to do now. It has been implemented and we have some positive results. So we will be watching very carefully our strategy as regards with just our college strategy and intercollegiate education group. And I'm sure we will be doing a lot of work to see what is actually working and what is not working. and why it's not working. But to do that, as you can imagine, there's a huge workforce. We have over 3,000 members and fellows, Jane, if I'm not wrong, SAS members and fellows from 10 surgical specialties and 13 dental specialties. There's a huge number. So we need manpower. We need people to tell us what they want. We need people to help us with how we do it. So my ask is, please get involved. Email me personally, email me via college, share what thoughts you have, share your work you have done, share your things which are working well for the individual association. We are happy to adapt them. So you will be working with us and you'll be working for your SAS colleagues. So please do get involved.
All I'd add to that is that if you're annoyed and if you feel that the college hasn't represented you, come and tell us about it. Come and join the forum and bring your anger out into positive action. Come and tell us what we have not done that we should be doing, and we will do it with you.
It's a big commitment. I will flag. So if you want to get in touch with the SAS forum for some broader historic reasons, it sits under my own remit. So if you do email the events inbox, which I know seems a bit contrary because it's not specifically about an event, that will be passed on to the wider forum and specifically to Vinita and Ananda. So if you do have queries, you can respond to the email that will go out from my team and we will make sure that they get across. So I realise that it's not an obvious place for it to sit, but the SAS group have always been looked after by one of our wider teams. So I'm currently helping support the group. So please do email in and we will do our best to raise questions, not just tonight. Anytime you need to, we can pass on issues and we can pass on questions to the group. We are coming towards the end of our time and I'm really, really mindful that there is a lot that we could have been discussing. I am just like to say that we will have more sessions specifically on some of these topics so that we can give them the time that they need rather than trying to sort of cover off lots and lots of different things for different people. I'm trying to find something suitable for us to sort of end on, really. I guess really it's about where do people who are experiencing difficulties, if we can't help them, I think we covered this a little bit earlier about how can they reach out and get the help that they need.
Shall I address that? I think, again, it's going to depend on the precise nature of the problem. And there are a number of resources within individual hospitals and outside, but as a college, again, if appropriate, there's the confidential support service, and that can signpost people to an appropriate source. If it's appropriate to contact you through the events email address, and again, if we can't deal with the problem ourselves, we can try to make sure we point you in the right direction. But we're very much here to help people, and if there are issues we can help with, then don't hesitate to contact us. Jane, I think that might therefore be the last question. Yeah. So thank you for that. It's been a fantastic session. Great to have so many people attending and great to have so many questions, which is fantastic. And I'm sorry if we haven't been able to deal with your question this evening, but as Jane has said, we will endeavour to deal with all those in due course. If again, I can ask you, if you wish to be involved with our plans around the implementation of the diversity report, then do use the diversity@rcseng.ac.uk email address that you saw earlier. And I'd like to take the opportunity now just to thank Vinita and Ananda for their contribution to this webinar. And many thanks to Jane and Misha, who's in the background doing all the technical hard work for supporting us. You will be able to see this website, this webinar through the website in due course, and please look out for our future webinars, which again are advertised on the website. So thank you for attending and we look forward to seeing you soon.